Welcome back to TV5 News at 9. Today we are talking about proton therapy with McLaren Proton Therapy Center Medical Director, Dr. Hesham Gayar. Thank you so much for being here, Doctor.
It is my pleasure to be with you. Thank you for inviting me.
Of course, we're delighted to have you. So, Doctor, what is proton therapy and how is it different from regular radiation treatment?
Proton therapy is a very particular type of radiation. There is subatomic particles that target or go for the target, whatever we delineated to structure to hit, and it spares surrounding normal tissue. So it precisely targets the cancer and it stops without exiting through surrounding healthy tissue, protecting the normal tissue from radiation, and it can give, hence, higher dose of radiation focused where it belongs. This gives a selective ratio of benefit to radiation, allows us to go to higher doses to cure more cancers, and allows us to spare normal tissue, hence reduce side effects and improve quality of life using the same cancer cure or better.
Wow, that's terrific. Now, today we're talking about cancers of the chest. So what are they, doctor? And why would proton therapy be so beneficial for that type of cancer?
Well, the chest is obviously a critical part of the body. And in the chest, there are many important structures. For example, in the mediastinum between the two lungs runs a compartment that has many important structures, and unfortunately many cancers occur as well. So the heart, the food pipe, the esophagus, the air pipe or the trachea and the bronchial tree, many important vessels, the aorta, many important vessels run in that compartment. So are critical lymph nodes that drain from the lung. It drains from the surrounding organs, the esophagus. So esophageal cancer, for example, is in that compartment. Lung cancer is very commonly involving that compartment, and there is the heart that we need to protect from any unnecessary radiation, as it is very harmful to get radiation to the heart, and so on. So are the main airways and other structures. So, for example, lung cancer commonly spreads to lymph nodes in the mediastinum, in that compartment. And to treat such organs with radiation, the conventional radiation gives unavoidable treatments to the structures like the lung and the heart, or both lungs sometimes and the heart. So is cancer of the esophagus. So when we're treating such structures, you end up delivering radiation dose. You cannot avoid it because conventional radiation goes through, and scattered and unnecessary, unavoidable radiation, even with the best planning techniques, exposes the heart, exposes the food pipe. Lung cancer patients have difficulty swallowing, have side effects during treatment, late effects with heart disease afterwards. With proton therapy, we can target those structures and we can have the beam goes where it belongs. Subatomic particles goes, and that's subatomic, that's beyond an electronic microscope can see. So it's really nanoparticles that can go and hit the target, does not exit into normal tissue, giving us an advantage of sparing surrounding tissues. So we can treat lung cancer without much esophagitis or side effects to the food pipe. And especially lung cancer is treated with radiation and chemo together, and that makes it difficult. Where proton can stop before the food pipe if we're treating lung cancer, and vice versa if we're treating esophagus cancer, treating the esophagus tumor without spreading the radiation to the lungs and to the heart, where even lower doses can hurt the lung and the heart on the long term in terms of quality of life and side effects. There are other cancers too, like lymphoma, for example, that involves that area, and even young people can get Hodgkin's disease, non-Hodgkin's lymphoma, thymoma. There are tumors of the mediastinum in that compartment that are critical in location, close to critical organs. Sparing those organs unnecessary radiation is important, and only with proton therapy this can be achieved. So patients don't know that when radiation is indicated. There are other forms of radiation with proton therapy that can spare those tissues. So it's important for people to find out if proton therapy could be used and is of benefit in their conditions. And I'm not saying it is indicated for every disease, but find out before you proceed with conventional radiation and expose normal tissue to unnecessary radiation.
Sure, that leads me to my next question, doctor. So how can people find out if proton therapy is the best treatment for them?
Very simple. Call us. Call 855-MY-PROTON or get on the website, the McLaren website.
Yes.
Put your information or contact us and ask, and we will help you remotely. You don't need to come. We can do telehealth and evaluate what's your need, what's your condition, and if there is a need, we can always see you and advise if this is better for you or not. And there are indications like breast cancer, for example, where left-sided breast cancer is on the chest and the heart is right behind the ribs on the left side. And in the treatment position, conventional radiation spreads those to the heart. So if you have left-sided breast cancer and you need radiation, find out if proton therapy, it definitely can reduce the dose to the heart, can spare your normal tissue unnecessary radiation, and that radiation to the heart, even lower doses, can lead to heart disease, heart attacks, ischemic heart disease in the future, several years later, but it is important, it's your life. So find out if proton therapy is a good treatment for you, and we'll be glad to help if it is indicated. The best way, every patient is an individualized case, so gather your facts before you proceed for treatment and find out what can help and what is best for your quality of life.
That's great. Just give you a call. Thank you, doctor, for this valuable information. We appreciate you calling in today.
Thank you. Thank you very much for inviting me.
Of course, you're welcome. And for more information about this topic, please head on over to the hot link section of WNEM.com.